The primary role of a chiropractor is to facilitate health.
People came to us and got results for the musculoskeletal backache problem. And we became more and more back injury doctors, musculoskeletal doctors, necks, low backs, shoulders, feet, etc. And this is when the profession, back in the early 1950s, started to develop in the field, especially in chiropractic orthopedics. And there was more and more concentration of interest in neuromusculoskeletal disease, not only the manipulative management of those type of disorders, but also the utilization of physical therapy or physiological therapeutics, heat, light, exercise, supports, braces, diet, nutrition. And I think the majority of chiropractors today pretty much practice that way. Chiropractors have pioneered many of those concepts we now see as holistic medicine.
Medical orthodoxy deals primarily with disease and illness. I think chiropractors take a more optimistic attitude. We're trying to recuperate the health in those individuals who have lost it, and we're trying to facilitate optimum health in those individuals who have it.
The ability to manipulate or adjust, to recognize biomechanical problems that can be addressed, the value of exercise, the value of physical therapy in treatment, the value of necessary psychotherapy or counseling. All of those are part of the practice of chiropractic.
Even though we specialize, in quotes, in musculoskeletal disease, we are a primary care physician. We're a general contractor. We're providing a whole health service to the patient we treat, even though they're on the other end of a neck problem or a shoulder or a backache.
The success is a direct consequence of a need out there.
The curriculum is extremely demanding, probably as demanding or more so than most other colleges. The load is demanding. The commitment is required. If there isn't commitment, it's not something you do casually.
Basic sciences are broken down here much as they are in any medical curriculum. There's gross anatomy, there's microanatomy, histology, cell biology, biochemistry, neuroanatomy. There is general physiology, neurophysiology, microbiology, public health. It's a full range from the anatomical sciences to the physiological sciences to the public health kinds of issues. It's a very broad and in-depth program. Our students are in class probably 30 to 35 hours a week just in learning the basic sciences. It's a very demanding program, particularly during the first 2 years where those basic sciences occur. The second 2 years are where the students learn the clinical sciences and begin to integrate what we have laid as a foundation of the basic sciences.
I wanted the challenge of a rigorous education, and I sure got it. I got more than I expected.
And most of us had several years of education before we got here, knowing we wanted to be chiropractors. We wanted to be physicians. So myself, by the time I graduate in December, I will have 9 years of education directed towards chiropractic.
It's been so long and such a long, difficult time that I almost can't believe that I'm graduating in 3 weeks. I like the feeling, though. I'm not complaining.
It takes time to evolve to this place where they call you a doctor.
One of the things that we do regularly with our patients is touch them. And we may be the only people that touch them in a caring way, or that touch them at all.
But right now, the important thing is really using your hands.
Palpation is where you're trying to palpate, to feel a structure, to feel a muscle. It's being able to identify with your hands.
Hand contact with the person.
Human beings, for all the different ways that we view ourselves, we're physical beings, and our skin is our largest organ, and tactile stimulation is something that we need, and something that interacts with us on a lot of different levels. Just your presence as another human being, touching, is very profound and very deep, and that's something that we do day to day. And I think that's part of the reason that We tend to have good rapport with our patients.
A big part of what chiropractic is hands-on.
And there's no way to get around that if you're going to do chiropractic. Almost every time you see a chiropractor, you'll get touched.
There is no permanent truth. You can't find out how the human being works, find out what it takes to make a person well again, and then be done with it. It just isn't that simple. That's where the healing arts become an art. It's a science and an art. The science we can work on. Those of us in the basic sciences, we can map out how this works and how that works. But in the end, it doesn't matter. What really matters is that you have a procedure that seems to work, that can reliably be performed by one physician and by another physician, and with reliable results.
The bottom line is that we want to see people get well, and we want to do it without having to use the drugs, and we want to do it without having to use the surgeries.
If you go back to the root of the word doctor, it does not mean healer, it means teacher. I think chiropractors differ somewhat from orthodox medical practitioners in that we try to educate our patients. Certainly we do treat them, and our attempt is always to heal them from their ails. But I think in the chiropractic profession there is an obligation on behalf of the patient to participate in that healing process, and the way that you reach that healing end is to educate the patients properly.